We turn now to the coronavirus pandemic. There are new concerns about another surge in infections. The number of cases in the U.S. is nearing 30 million, and the death toll has topped 545,000. Meanwhile, as more students return to classrooms across the country, Education Secretary Miguel Cardona says all schools could be fully open by the fall. Meg Oliver reports from New York City.
Tonight, there's concern as COVID cases rise in nearly half the country. And for the first time in weeks, the CDC's National Ensemble forecast is predicting deaths will not decline.
When you're at that level, I don't think you can declare victory and say you've turned the corner. You've got to continue to do what we're doing.
New studies showed that fully vaccinated people can get COVID, but it's extremely rare. One study found that only 7 fully vaccinated healthcare workers out of 15,000 in Los Angeles and San Diego tested positive for COVID.
That's where we want to be. When, as a country, we are at that level, we will have turned the corner.
Today, 12 state attorneys general called on social media giants to block online vaccine conspiracy theories, targeting people of color and Black Americans, specifically members of communities who have suffered the worst health impacts of the virus. Those communities also suffering the worst inequities in education.
We still have work to do, lots of work to do. You know, we know there are inequities to in-person learning.
New data release shows just over a quarter of white students are learning online, compared to nearly 60% of Black and brown students that are learning remotely.
It is no surprise that
Elma Roldan works with low-income schools in Los Angeles.
Do you think this will initiate any real lasting change?
I sure hope so. There's a real conversation today about, one, how much more we need to invest in our youth, in our young people, but also the equity in how we distribute those dollars to support kids who have already lost so much.
Here in New York City, the mayor announced today he will use money from the Pandemic Recovery Fund to make preschool free for 3-year-olds beginning in the fall. Families who enroll in the program are expected to save $10,000 in child care costs. Lana?
Meg, thank you. Infectious disease expert Dr. Amesh Adalja joins me now. He is a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, thank you. The pace of coronavirus vaccinations in the U.S. has nearly doubled in less than 2 months. What are the biggest obstacles, though, that we still face?
It's still something that is difficult to get. You have to open multiple websites. You've got to look around to see where appointments are. You have to make sure that your state, that you fall into a certain priority group. So there's still a lot of friction and bureaucracy that you have to go through. It's not like getting a flu vaccine. It's getting better, and we're already seeing the benefits of this vaccination program. But we want it to really go with no speed limit, 24/7, as much as we can get into people's arms, and every day we should. And I think we're going to get there as we get more supply, but there are still some kinks that are being ironed out, and each state is a little bit different.
It is at times difficult to have these conversations about it because, as you say, it differs so much from state to state. Still, Dr. Anthony Fauci says that new research shows that vaccines are, quote, extremely effective at preventing infection. But given that and the fact that vaccinations are speeding up, why are health experts still so concerned about spiking case numbers?
The big concern is that there are still some vulnerable populations that have not been vaccinated, those high-risk community-dwelling individuals who could still get infected and still land themselves in the hospital. We still have about 36,000 or so people in the hospital. That's a fairly high number. I suspect it's going to come down over time as we get more vaccine into people, but that's the concern, is that if cases spiral out of control again and land on vulnerable populations that have not been vaccinated, we could put hospitals in a little bit of a crunch again. I think that this is becoming less every day because each day we put 2 to 3 million vaccines into people. More and more people are getting protected. So increasingly, we're going to see cases decouple from hospitalizations and deaths. And I think that's where we're headed. We're going to sort of tame this virus with vaccines. But it's going to take a little bit more time, a little bit more patience to get more vaccine into people before we completely can see kind of the light at the end of the tunnel. It's glimmering now, but not completely a full view of it.
Little sparks of light, I guess. But to stick on this topic for a moment more, for the first time in weeks, the CDC is actually not predicting a drop in coronavirus deaths. How concerned are you about where we are in this particular moment?
Well, when you look at the CDC modeling, what they're talking about is not an increase in deaths, but they're saying it's plateauing, it's flattening. I think that this is really going to be dependent upon vaccination, because the more of our vulnerable populations that get vaccinated, the more likely we are to see deaths decline. They are eventually going to decline, but with those cases going up, I think the CDC is kind of hedging themselves and saying it's going to take some time to see those deaths actually decline, because cases are going up and they're still concerned about people that are not vaccinated yet. I think we have the ability to reverse this by accelerating our vaccination progress. And as well as, if you're an unvaccinated person, just remembering we're still in a pandemic. So continue to wear your mask, continue to try to avoid crowded and congregated places, continue to wash your hands. All of that's going to still be important for the next several weeks to months to come.
Good reminders. A new study published by the CDC found that communities with high coronavirus infection rates from April to December of 2020 were counties with large racial and ethnic minority populations. How important is it still to address these disparities, especially now as cases are potentially, as you say, plateauing, but some people are getting the vaccines and others aren't?
It's incredibly important that we reach communities of color. They have been overrepresented when it comes to COVID cases, COVID deaths, hospitalizations, and they're also a place where there is less vaccine uptake. So this is going to be very critical. And I think it's because there are lots of things that intersect with these minority populations in terms of how many of them are essential workers, how many of them live in multi-generational families, how many of them are not able to social distance. All of that is really kind of synergizing along with obesity, diabetes, things that we've already been talking about throughout this pandemic. All of that is kind of coming to a fore now, and people are realizing that these types of situations are going to make us less resilient to pandemics. So I think it's very important that we reach those communities and specifically target them with vaccine, with social distancing recommendations, and public health in general, not just for this pandemic, but for the next one. I think we have to get this right, or we will still have kind of kindling for pandemics to really decimate certain populations more than others.
An important way to think about not just this moment in time, but where we are in terms of health disparities overall. Dr. Amesh Adalja, thank you.
Thank you.